We're back with Catherine Sevier with AARP of North Carolina and Steve Edmonds with Alliance Insurance Services, and we're talking all things Medicare. This person says, will insulin be in the first round of drugs to be negotiated? My copay right now is over $500 a month. Catherine?
It is in the first round, and you should be charged no more than $35 a month for your insulin. So if you're being charged that amount, you need to check with your provider and with your pharmacy to see what's going on.
Because you can call them and say, it's supposed to be this. Do I need to switch to something different, or do I need to call it into a different pharmacy or shop around to the pharmacies?
Correct.
Okay, because it should be 35. Steve, did you have anything to add to that one?
No, no, that's exactly right. I mean, that has already been rolled out, right, and the insulin is part of this, so 35 should be the cap.
All right, can I get Medicare at age 62, Catherine?
No, you can't unless you're disabled. If you apply for a disability and are accepted through the Social Security program, then you are eligible to be covered.
Okay, Steve, this person says, I'm turning 65. I have military Tricare, but all these companies are trying to set me up with additional Medicare supplemental insurance. Do I need that?
Probably not. Most of the time, the Tricare is going to do the job for a person in that situation. There are some other coverages that can work kind of hand in hand with Tricare, with some drug coverages or some Medicare Advantage coverages, but typically Tricare will take care of the job at hand for this person.
Okay. This person says, after I signed up for Medicare, my first payment has come out. Am I eligible to go and have a colonoscopy, or is there a grace period that I need to wait?
You should be good to go. You should be able to go ahead and start with your care right now. It has to be medically indicated and you meet the criteria for the treatment, but go for it.
Okay. This person's asking, does Medicare Advantage cover rides to and from doctor appointments?
Some plans do and some plans don't. So you need to check with your insurance agent to look into that for you. But there are a lot of plans that will cover up to 14 trips per year. And now they count a trip as a one-way trip. Your home to the doctor's office is one trip. From the doctor's office back home is yet a second trip. But a lot of policies are including that now, but not all of them.
Okay. If you're on disability and you turn 65, do you automatically go to Social Security, or do you have to call and sign up for Medicare?
Are you already on Medicare?
Right. We don't know that. But if they're on disability, it doesn't automatically sign them up for Medicare. They actually have to go and sign up.
If they're on Social Security disability and they're already getting Medicare, it does carry over at age 65. But if they were determined disabled like at age 64 or something like that, yeah, you may have to do some follow-up if you were really close to 65 when you were declared disabled.
This person's asking about where to get dental care outside the Humana PPO base plan, which does not cover dental or vision.
There's tons of dental policies in North Carolina. You know, I can think of about 4 or 5 dental plans right off the bat that do really good, and you can tag them on to Medicare policies to make you have a decent dental benefit there. But a lot of the Medicare Advantage plans have really good dental coverage built in already. It's just according to what you have.
All right, this person says, if my insurance has Medicare already, do I still sign up? I'm not really sure what that question actually means, but if they've got insurance at their job, they still have to sign up for Medicare.
Absolutely. When they turn 65, they have to sign up. And like we were talking earlier, they may be in a program where they can defer Part B, but they have to check the box.
All right. And then somebody asked, can an insurance agent sign up a person for Medicare benefits at no cost to that person? And I'm guessing, Steve, the answer is yes, you can help them do that.
Yes, most definitely. And insurance agents are happy to do that. But keep in mind, we're not signing you up for Medicare. That's always done through Social Security, we would be helping you get a insurance plan to coincide with the Medicare coverage.
Correct. Okay. As always, more questions than we have time for, but we appreciate your time and your expertise, both of you. If you missed any of this, we want you to know that it's going to be in the Two Wants to Know section.